medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Pleasant good morning to all of our Q listeners here with us on 100.7 FM. Welcome to another edition of the Pulse Radio Show. I'm your host, Shane Seeley, Communications Specialist at the Queen Elizabeth Hospital. Always a pleasure to be here with you Monday mornings at 11 a.m. You know how we do it. We try to share all that is going on at our hospital. We try to give you better direction, some of those answers to your questions. Of course, we take calls, and we just have so much happening at the hospital right now, and we've been in the news a lot in terms of explaining what has been happening with our accident and emergency department, our hematology department, and other departments across our hospital. And I can tell you, we have some more updates for you today. So remember, you can call us 434-1007 and 434-1070. You can also send us a WhatsApp at 434-1007. Well, as I said, we have some updates for you. Things are still a bit interesting in our accident and emergency department. We're still seeing those numbers coming in. We're seeing a number of complications with chronic non-communicable diseases, and our medical teams are responding to those patients. We are also seeing some respiratory illnesses coming in as well. You know, people having difficulty and challenges with the increase in respiratory illnesses that we are seeing across the board. And we have our infectious disease specialist here to tell you a bit more about that, because you know, I always come with a guest or a few guests. Last week it was our nursing team, and remember, in this season we're focusing on what we have been doing at hospital, those improvements and enhancements that have been coming into play. So there's some encouraging news as far as that is concerned, also in clinical and diagnostic services, and that's why we have a fan favorite, Dr. the Most Honorable Corey Forde, here with us. He's our Director of Clinical and Diagnostic Services. He's the director there, and he's been really overseeing a lot of the changes over that landscape, some of the enhancements, some of the improvements. So we'll be talking about that this morning, as well as some new services that could soon come on stream as well. Dr. Forde, a pleasant good morning to you. Thank you for being with me on the Pulse Radio Show. I know you are very busy right now doing some onboarding and other things, but yeah, it's great to have you as always.
Hey, it's a real fantastic for me to be here for you this morning. I'm going to break tradition a little bit, so
that's all right.
Bear with me.
You can do as you like.
I am going to do something a bit odd, but it's not odd for me. I just, given all that's been going on in country, certainly in the hospital and in general in health, etc., I'm just going to ask to say a very short prayer for the hospital and our country, if that's fine. Dear Heavenly Father, I just want to thank you for giving us the opportunity today to bring to you all the work that we're doing at hospital, that you look down and see. I pray for those who are ill within our facility, and I also pray for all the staff throughout the facility who give of their best continually to try to maximize the care within our facility. I pray, Lord, that you give us strength, that we give administrators wisdom in making good choices, not only in management of patients, but in terms of administrative decisions. I pray all, Lord Heavenly Father, that you continue to guide us as an institution and strengthen us. And we pray, Lord, that you will, show by the work that we do the importance certainly of healthcare, and that every single person out there will understand the importance of healthcare and making themselves as safe as possible. Amen.
Amen.
It's a bit different, but forgive me.
I know why would I forgive you? It is the right way to start every day. I try to do it every day. Say a word of prayer and give thanks. So those things are important. And I really hope that your prayers continue to be answered so that we can see our patients getting the improved service that they deserve from us at the hospital. Speaking about those improvements, as I mentioned in my little interlude, my little prelude, you have been overseeing a lot of those individual improvements that we needed to make. I remember one was the laboratory. And things are...
I have some great news about that.
Oh, okay. Well, let's go ahead.
Okay, so I'm responsible for infection prevention control, obvious infectious diseases. I'm also responsible for radiology, lab services, central sterilization and disinfection, pharmacy as well, and recently sent over clinical nutrition services, which I'm not unhappy, but I'm quite happy about that. It's a bit different. And I just wanted to upgrade. So I think everything we are doing right now is try to be in line with that 2020 to 2028 strategy. And we've gone in a lot of places with things. Some are a little bit lagging for many different reasons, as you would know. But we've done a lot since I last been on the show. And I just want to take the opportunity to share that to you, Barbadians, and know that we're really working on the ground. You know what? Truth is, everything's not perfect, but we're really trying to get there, and I just want people to understand that. So in terms of I'm going to start, because I'm going to be selfish, so I'm going to talk a little bit with infection prevention control. And some may call antimicrobial stewardship, big word, but it means simple, like bugs, drugs. The bugs are better
when you say bugs,
I'm talking about bacteria. Everybody always think like just bacteria, but bacteria, viruses, fungus, you know, and parasites. But I talk much about that. So those bugs, right? They don't respond to the classical therapy that we have available.
And this is like everyone always wants to get their antibiotics.
Yeah, for everything. If you sneeze, they want antibiotics. And right now, it's like, a lot of respiratory viruses are going around, whether it's COVID or influenza or normal respiratory syncytial viruses. Lots of viruses are right there. They're going around in our societies, and people need to be careful. But when we talk about bacteria, for example, we talk about improvements. What we've done since I was here last, I would have spoken to you and told the public, hey, we're trying to start or expand on what we call antimicrobial stewardship, which is good use of antibiotics within hospitals. In short, good and effective use of what we have, and also expanding our antibiotic profile in country. What I'm able to tell you today is that we've expanded the amount of antibiotics that we have available, not in terms of the number, but in terms of the types. And some of them are pretty expensive, mind you, but we've been able to curtail that to use for better use. We said last time we were here that we're going to have an antimicrobial, we're trying to get an antimicrobial pharmacist, which is something totally new for Barbados, and we have done that, interviewed, in play, and now we're setting up an expanded program. Dion Jacobs, I give a massive shout out to you. You've been working tremendously, even before you were appointed. Like to say that out there. We are just about to have a clinical pharmacist, which is something that's new within the system. And I think that having a clinical pharmacist will transform. So if still a pharmacist spending all the time in pharmacy, to spend a little time interacting with the doctors in the ward, really making a real holistic approach to management of a patient in the hospital, having the pharmacist involved, looking at drug interactions, looking at telling the doctor, hey, interfacing with the doctor, say, hey, maybe you could try this, you should that. Kind of like what when I was training overseas, both in South Africa and Canada, kind of like what I saw.
Take a pause there. We do have a caller. Good morning. Welcome to the Pulse Radio Show. How can we help?
Hey, Shane.
Hi, good morning.
To Mr. Forde.
Hey, good morning to you.
Hopefully that you dress like a doctor, not a lawyer this morning.
Actually, he does look like a lawyer this morning.
Every time I see Mr. Forde, I can't get it figured out. I know a doctor's not really wear white, but I always see him in a lot of black.
No, he's very connected to his African roots. He normally has on a lot of from his travels. He has been to several countries in the African continent, so he always shares a bit of that fashion from these different destinations. So you get to see that firsthand.
Shane, you're gonna get me in trouble.
Yeah, but he's always working to improve himself.
I like your explanation for it, but I remember he told me to Forde that when he was on morning Barbados. I can't remember if he remember telling him that. He more looked like a lawyer than a doctor because he was dressing all black.
Well, we need someone to broker improvements at the hospital. So,
but since you explained to me, then if he dressing all that black, I might not recognize. He might get late down joining night if I don't spot the light.
But we don't want that.
You don't want that to happen. We have enough work at the hospital. Yeah. A&E will be more busy if more people get knocked down at night.
So you gotta be careful with that black.
Yeah. Anything we can help you with today?
Yeah. Actually, I had a problem. Someone with I can't even get the name called now. The blackness overclothed me. But physiotherapy.
Physiotherapy.
Physiotherapy. I hear with Forde that he says it's infectious or is infectious doctor. I don't know.
He's an infectious disease specialist.
He's an infectious disease. He said
infectious disease specialist.
Well, if he's infectious, I don't know. That is another thing.
No. But what happened with physiotherapy? Is there an issue there that you're seeing?
Right. No, my problem was that they say that if your problem is not serious enough, do not come to the clinic, but go to the polyclinic.
Okay.
You know they say that.
Well, I actually am responsible for writing that communication. So what is exactly, let me tell you what exactly, let me try to explain this a little bit more.
Right.
Yeah.
We always say, if you know, because people generally know what is going on with them. But when you're unsure, you're always told, I give you a number to call, 536-4800. There's something called teletriaging, which is you speak to a medical representative on the phone, you explain what is happening with you, and they give you direction on what your next step should be. So when you call that 536-4800, that is what you will have the opportunity to do. So when you do that, they will be able to tell you, well, I think we can call an ambulance for you. I think you should go to your physician, or you should go to the polyclinic. You'll be all right till tomorrow. You can do this, and you should feel better. But all the time, anytime that you are extremely unsure, you should make your way to the accident and emergency department. When you get there and you're assessed, you will know, and you will find out from our medical personnel there, how serious your condition is. If you're not as serious as there are several categories, and I wouldn't go into those, but if you're not as serious as some of the other patients there who come in with trauma, who come with serious complications with their chronic diseases, you will wait till we deal with the more urgent cases. And that is where the problem comes. When people are waiting and we're dealing with urgent cases because your case is not as urgent. It is urgent to you, but in the lineup, in the cases that we're dealing with at that point in time, you are down the line. So that's where the waiting sometimes comes in, and people don't like it. It's an inconvenience because you want to get back to your normal life. You want to get back to what you do, what you are, what happens with you. And Dr. Forde can go into a bit more about this because I'm non-clinical.
Yeah, but I want to say something before Dr. Forde come in to see if he agree with what I say or not.
Okay, go ahead.
Right, judging off of what you said, and I went to the polyclinic. It is not life-threatening, right?
Right. And just by the way, if you could turn off your radio in the background, because I can hear myself coming back at me.
I'm physically challenged though.
No problem. You continue. It's not
right,
that horrible.
I think you could hear me good
I
enough.
can hear you. Yes.
Right. Cause from the time I say spotty, like you got what I said with Mr. Forde and his black at night. So, but anyhow, all the seriousness. My thing is.
You went to the polyclinic.
Right. If they're saying that, right, and the doctor at the polyclinic write up a prescription for you, right?
Mm-hmm.
Shouldn't it be able to change at the hospital?
And Dr. Forde will explain why not.
But he got to come real good at explain that to me, because to me that don't make logical common sense. Cause my daughter work at the bank, right, and I was telling her over the weekend that the doctors now working out a layaway plan for you. You don't have to go to the bank no more. They're putting you to death now.
Mm-mm. That is not the case. Dr. Forde explain why polyclinic prescriptions are not filled at the pharmacy at the hospital.
So it's a bit different. Interesting question. So as it stands right now, you have to understand that some of the drugs that are available in hospital are not necessarily available in polyclinic, and the different tiers of drugs. So you may have a drug that may be a polyclinic system because it's used for mainly outpatients, right? Not ill outpatients like you might find at the hospital sitting waiting, but you might find them in the hospital, or vice versa. In the polyclinic, for example, you may have drugs that are not prescribed because they're not on that particular level of pharmacy, and because of sophistication and there's associated with the use of specialists. So when you have a prescription from the polyclinic, it's not always something that you will take in the hospital, and certainly the ones at the hospital, some of them you won't find in polyclinic. So although it sounds interesting and good to you, and it sounds like a bit of like a common sense scenario, the two systems work on two different budgets, and the availability of certain drugs in the polyclinic sector and the hospital sector are different. So I don't want to call drugs, for example, but there's some drugs that we use in hospital which are specialized drugs that you will not find in the polyclinic, and that's why the patients come to the hospital patients clinic, because the doctors, they're the only ones technically who can rate them, and some of them are what we call specially authorized drugs. So the two systems interface, so we help each other if there's challenges, and we have to work together as one healthcare system. But of course, we are bridged differently. So I just wanted to appreciate that fact.
And not only that, Dr. Forde, I will add to that when you're dealing with the polyclinic setting, the polyclinics are primary health care.
Yeah.
The QEH, the Queen Elizabeth Hospital, is the end of the line, tertiary health care. So two different levels of care, as Dr. Forde rightly said, two different budgets. So that is why polyclinic drugs.
I hear that, but to me, it suppose it's a life-threatening incident, and the body can fill out the prescription there, and then at the hospital, what are you gonna do?
So
let the body die?
Good question. No, you're not gonna let the person die.
That's my point.
But you ain't let the person die. That would be a bad doctor, not a bad doctor. I love people. You should know that.
That would be an infectious doctor.
Listen, right. So what will happen in that scenario is the polyclinic doctor, if they had a challenge with availability, they will actually contact our pharmacy. It's happened several times to find out if we have that drug or if we can help you. I mean, we're not mean people.
There's one other thing to that, one other spin to that. If it is a life or death situation, the person would be coming to accident and emergency, so they would receive the treatment and the medication there.
Yeah. So those systems are in place, so they can call us sometimes when things are not available, and we will call them if we need help with anything. We work together as a system to make things happen, and we have direct communication with the drug service on these issues. So.
And you hear what you mentioned there. If the person is critically ill, if you're going to let them die, if they're critically ill, they should be in the accident and emergency where they will get the care.
Right. But I still at a loss with that, because
you can't be at a loss. You just get a full explanation.
Listen to my point, right?
I got a commercial break to go to, so
you can go to the commercial break and come back then.
All right, that's what we can do. We'll take a break here.
Do that.
Dr. Forde still has a lot to talk about as far as his director is concerned, clinical and diagnostic services. And we also have to share some news with you, some updates with you about our hematological services as well at our hospital. You're listening to the Pulse Radio Show, compliments MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Back with you on the Pulse Radio Show. We are engaging one of our callers here, speaking about how we operate as far as medication is concerned and filling prescriptions. Of course, polyclinic prescriptions are not usually filled at the Queen Elizabeth Hospital. That is not the modus operandi. We normally have the polyclinic prescriptions filled within that system, and then we have prescriptions that are directly and specifically for the Queen Elizabeth Hospital, which are filled in our pharmacy. What also happens, there is our medication delivery service, and you can call 536-4804. I think it's 4804. I gotta double check that though. But you can call the number for medication delivery service. It is on our website. You can also find it on our socials as well, or on our Instagram page. You use that contact and you call us, and we can give you all the information you need, and you can find out how you can get medication delivered directly to your door if you're a patient of the Queen Elizabeth Hospital. So we make things convenient for you right there. Caller, you were continuing your dialogue with us here. We were trying to explain to you why we were trying to stick within the system.
I'm not, but to me it's still a flaw in it, because you could decide, I dare say, that you go over, it is not serious enough and you don't go to the hospital, you go over to the polyclinic, right? Mm-hmm. Until you leave there, by the time they get the right prescription, until you could pass away. So that is my point to it.
No, but if you are feeling that bad,
that you say it is not, you won't know it till you get there. You know, to you it might not be a bad situation till you get there.
Till you get where?
That's my point.
You mean to the? Well, so I've been trying to get you. You mean till you get to the polyclinic?
I mean, you say, you all are saying, unless it's a serious, I wouldn't know how serious it is till I get to the polyclinic and there describe what. Right. So time I get over to the hospital there for somebody write up a prescription, I could die there.
No. When you're at the, let me help you. I know you must like our pharmacist at hospital.
I like your pharmacist.
That might coming across.
We have to that way telling you no. But you were dead there.
No, you won't. What I'm going to tell you is, if you're at the polyclinic, right, and you are ill and you are unwell, right, and you have to get medication, and they send you to the hospital, they're probably going to send you to the emergency department to be evaluated to see what type of medication you're going to need. Right, so I think that's the first thing you have to put in your head. But
and they probably give you medication while you're on the way.
Exactly my point. So they will start the medication once they have it available, and if they don't, they can they sometimes even contact us, and we can interface medication. It's one healthcare system, sir. It's one healthcare system, so we continue to work together. Even behind these things happen all the time, and we help each other out, right? So, and you'll never be in a situation where, we're never going to say no to giving medication. That's never going to happen. We will try to help each other out. Yeah, ultimately, we want you to live much longer than you've lived so far. How old are you, sir?
Actually, if I reach next year, if I read that year, I will reach what they say to reach 3 scores and 10.
Okay, so you made.
I still look younger than before. I dress in a lot of white, not black.
You are something else.
I'm not only a poor, I'm a humor. I like a lot of humor.
I'm gonna let that one go. I'm gonna let that one only for you tomorrow.
Because I know how to take her dress in black also.
Oh dear.
Oh Lord.
Listen,
But for you tomorrow, I'm gonna wear something colorful to work. And I'll sure.
I want when Mr. Forde is coming on the TV or anywhere that he put on his doctor gear rather than a lawyer. To me, it would make like if I had to go and visit him.
Okay.
Right, and I go in there and I see him in black. I would head over to the probably the hospital or one of the polyclinics.
But I wish you can see me now because I'm wearing blue. But
Right.
that's okay.
But listen, thank you again for calling and sharing with us. You've helped to address an issue that we always try to clear up. So it's good that you can raise that here on the Pulse Radio Show. So generally, the rule of thumb is polyclinic prescriptions are filled within that system. QH prescriptions are filled by our pharmacy. And remember, you always have the option of the medication delivery service. You can call us and we can help you get connected and really make it a lot easier for you to get your medication and get your prescriptions filled on a monthly basis. That way, when you call 536-4804, I was right.
Correct.
You can have one member of our team share with you how you can be a part of the system. All we need is your name, your national registration number, your QEH hospital number, preferred delivery address, 2 current contact numbers, and the name of the medications on your prescription. Outpatients are also reminded that medication delivery requests must be placed at least 3 to 5 business days prior to the start date of your repeat medication, the date of the repeat medication. So that simply said, do not wait till the medication runs out
Absolutely.
to order new medication. When you see it's getting a little low, 3 to 5 days, you make that call so that you can have that next delivery on time, so you're never out of your meds and you would not fall into the realm of one of these patients, who is not following their medical regime and ends up in accident and emergency with complications for whatever condition they have.
Okay. So, we're talking about pharmacy just now. We're talking about some of the gains we've made in pharmacy. Some of the plans, based on what we said last time, we've created the appropriate posts, clinical pharmacy posts, and getting the pharmacists on the wards to interacting with that, because healthcare to me, managing a patient as a physician, also internist, people don't know that, but as internist as well, one of the things you do is to not only incorporate people's medication, but the nutrition services. So I'm going to go over next to nutrition services.
Right.
Nice and smooth. And to tell you that I think that service has developed a few things since we've been last here. Falls in nicely with our overall plan in dealing with NCDs. So the overall plan, of course, is to have every single patient potentially, once we have the appropriate staffing up to grade, to have almost all patients in hospital come with diabetes, hypertension, to give them that advice so they go back home with that particular advice. But in the interim, what is being started is the bariatric type clinic or obesity type clinics, outpatients, dialysis, outpatient people on dialysis, what they should use, what they shouldn't use, to try to decrease. If people don't know, sometimes they go and have a whole set of coconut water because they hear coconut water is good for the kidneys, but it's pretty bad if you are a patient who has kidney disease. So that clinic is to try to start educating those in dialysis on the ground about what they should use, what they shouldn't use. Those who are obese. Barbados has a lot of people who are either overweight.
Yeah, the rate is pretty high.
Or obese compared to many places in the world. So to start, making inroads into that, and even in terms of the children population, to start, giving inroads, and the own government and educational ministry has been working tirelessly on that particular component. So we're doing some work in that in terms of but some more exciting stuff following off again from when I speak about pharmacy and antibiotics. Last time we were here for the hospital, just showing you how we're progressing to 2025 into 2028. We were looking at getting some new piece of equipment in the hospital to give very quick diagnosis. So normally in the laboratory, you make it really simple for those who are listening. When the doctor takes blood and it goes downstairs and you're trying to find which bug is causing you the problem, in general, what we normally do would go through a whole long process, which sometimes can take 48, 72 hours, even longer than that on some occasions. What we now have in the hospital as of recent recently placed, like last week, recently placed.
Wow.
On the ground, and I'm so excited about this. You don't even understand. We will now move from taking 24, 48 hours to making a diagnosis on bugs. Once that blood culture rose, that's bad, we can identify that in our laboratory now in 25 to 40 minutes. That is a game changer. We are now in tune with global.
I want you to stress how important that dynamic is, that changes in terms of having that new piece of equipment to the delivery of other services, because all of these things are connected.
That is going to be amazing in terms of delivery to services. And right now, they not see a massive rollout because the staff are still training this new, like, super techno piece of equipment. Those are game changers. I'm excited because it's real game changer equipment. So when a patient comes in and you send it off to the lab, it has to go down. They cook it, but they put it in this device and try to get the bugs to grow. And then you take them out and you put them on a plate, and then they grow. And then you take it off here and you put it somewhere else, and then you put it somewhere else. And that takes a long time. But now we have the capacity that once it grows here in the bottle, we can now identify that bug quickly. So the guys are still doing training. That is being fully rolled out because obviously we have new equipment. The staff is, I think, eager and excited, and they have ownership of it. A beautiful set of people in microbiology. Shout out to those in microbiology today. And it will be a game changer in terms of length of stay. So I can figure out two things. The bug early. Now, it's great for me because I get to figure out what antibiotic to put them on from even earlier. And the length of stay obviously might be less. So we'll have to be chopping and changing antibiotics waiting on a culture report. But it also means when people leave hospital faster, it means that people who may be waiting in the emergency department get to come up faster because other people are leaving faster. It means I don't develop the degree of antimicrobial resistance in our country that we were headed towards, because I get to start on the right antibiotic from the beginning. I don't get to chop, change, trying to figure out what's going on. I get to know that information faster. So it makes everybody faster, from the patient who gets better faster to the doctor who's happy to see the patient leave and see them well, to the family who's happy to see that patient back at home. But we also in this process get to identify quickly what bad bugs we have in country that we probably didn't even know that we have, because the machine has that capacity as well. So you need to, by knowing that, you know how to prepare for the future. So it also sets you in a position to prepare to treat people in the future, knowing what is out there within the community. Because I tell you, people talk about bad bugs in the hospital, but I tell you, we're seeing the bad bugs now coming from the community, which is quite interesting. It means people are using antibiotics willy-nilly, not only in themselves, but sometimes in animals.
What's the danger of that? Just using your own intuition or your own making that self-diagnosis and going and picking up antibiotics and just taking them.
The danger of that is simple. Is what people need to understand quite clearly is that when you use an antibiotic, what it does, it doesn't only kill the bad bug you're trying to kill. It's going to kill everything it can kill. And the only things that are left behind are the bad ones that the antibiotic cannot attack. And sometimes they become your normal bugs. If you look at your skin, you can't see them, but they're there. So we kill off all the nice things, and you're only left with the bad ones. Then they can become your normal bugs on your skin. So if you get an infection in the future, what happens is that infection sometimes is very bad, and the antibiotics that you used the last time will no longer be able to be used. So I think that in itself, certainly in those 3 coordinated divisions, we talk about nutrition services, we spoke about pharmacy a little bit, we spoke about laboratory services, that we've really seen since I've been here to report to you some good news. And then we're going to really roll it out to the rest of the hospital and really educate our physicians on these new pieces of equipment, etc. As the staff continues to be educated there. And I think the staff, one of the things I always say to the laboratories, I think they're always ready for improvement and changes within the system. And that's something I really want to congratulate them for, in jumping on and trying to work to see this through to the end. Congratulations to the microbiology team and all the others in the laboratory.
We got a question coming in from WhatsApp. Dr. Forde, hey, good morning. My dad was transferred to the Queen Elizabeth Hospital to get an operation done. The last couple of appointments, they couldn't find his notes. Would you believe he's there all now for another appointment and they're telling him the same thing, that they can't find his notes again? Don't these people pull files or notes the day before the appointments? It's really not nice wasting people's time. Then wait till 1 p.m. from 10 a.m. To send them home with another date to come back. That's a question coming in from WhatsApp. Very fair one, and this is not what we would like to see in terms of not being able to find notes. I will always say to people, call 536-4800 and let us do some preliminary investigations, especially if you would have gone through this situation before. Let us do those preliminary investigations to tell you, have you found your notes, where your notes are at, and then see if we can get an appointment with your notes so that when you come in, you can be assured that you are getting the service provided to you.
Yeah, but I mean, again, it's not one of the areas that I control. However, right, I mean, there's certain basic principles. I just wanted to tell the person who WhatsApp that to the show, I just want to first apologize.
Yes.
Because if you've been through, that, anybody out there has feelings, and, you come in and you wander around and know what's going on, or you really want to see the doctor and you feel you're coming and then, find your notes, I totally sympathize with you. I think you take the route of which was said by Mr. Seeley. I think you take that route and you made that call. I think that's important, but because it needs to be investigated. You try to figure out, why is this continually happening to you as an individual? And I do apologize. And if you're day to day, I hope that you can, send your number. Maybe we'll try to get somebody, not on the radio show right now, but we try to get somebody to reach out to you, because, I feel you on this one, and I do apologize on behalf of the entire hospital administration. These are things that we don't want to happen. We know they can happen, even in the best of circumstances. But to stick a pin and tell you that I believe that this might become a thing of the past in the very near future, when we have our new electronic medical record system, which means that you will not be dependent on notes, and you're going to be then focusing on everything's going to be electronic, so the doctor can see all your files electronically, etc. So
what would happen with that too? The patients will have their own notes,
and you can have your own
electronically.
Records. You have your own patient, like they have in some of the other countries in North America. You have your own profile of notes, your own laboratory tests, your own clinical stuff. All of it will be available. But I just really want to take the opportunity to apologize to you, and please leave your contact. So I'm sure they'll have your contact. We'll try to get our patient relations services to reach out to you, and certainly you can continue to communicate with them. And we hope that sometime when we come back on the show, it may not be me, but someone else, you can call in and say this is resolved. And I think that's where we need to get to. Thank you.
We want to share those responses with you when we have that opportunity to do so that you can see the system working, see it in action. So for that person who would have sent that WhatsApp, if you can call us here on the show at 4341007 or 4341070. If you don't want to talk to us directly, you can always leave the information with our producer Kimberly Skeet. She will share it with us, and we will investigate so we can see if we can get to the bottom of that situation. What are some of these other things happening in your directorate, Dr. Forde, that you'd like to share with the public?
Yes, I realize that time is getting short, and I have so much to talk about, but that's fine. Look, so the other one of the other key departments, and one that I kind of left it for down because it's one of the areas you're working on. There are always disappointments with things that you do. Even when you try to get to strategy, you just rewire and you start again. I would really hope that when I was here today, that I'll be able to tell you we had our teleradiography service, which is basically having images being read by other professionals outside, and so we can get back our results fast for X-rays and CTs, etc. But we're not quite there yet. Everything's in place. It's been written. It's been drafted. It's through the system. It's just in a particular part of the system, and then once that leg is gone, we probably have it in place. So I expect that when I'm back on here again, once it's not next week, that I imagine that will be in place. Additionally, we would know that we got the CT scan in the emergency department. We're going to see some challenges with that, but that's fine. It's being worked on, not related to us. And then the X-ray services are now back into the emergency department. They've been out for a number of years. We kind of got that back there, so that will speed things along. And then, of course, when I remember specifically when it was here the last time, a caller called in and told me, Dr. Corey, I hope why the hospital don't get an MRI? And I told you it was coming. I got more information for you now, so I can absolutely assure you today that we are moving swiftly before the end of this year to have a setup for a MRI within the institution, and we're going through all the details of that type that we will want. Something fancy, nice, but also that gives us what we want within the department, and we have the appropriate staffing for it, where it's going to be located. All of those things are being worked on now, and that's being done by our beautiful director, Ms. Paulo Agbuwu. Is working on that along with a whole fledge of teams in that particular service. So I just wanted to also to tell people that, because I think it's something that's important, that the Barbadians will now have access to that as well.
So what would that mean once we have that MRI installed, up and running, the staff trained to in terms of not only properly using it, but making sure that
appropriate protocols. Because that, to me, it's okay to have a piece of equipment. When people have, you ever got a new toy as a child? You play with the toy.
You don't read the instructions. You just go straight to it, and then something happens with it, and you want to know. You're crying. You want to know what happened to my toy, but
exactly.
You should read the instructions first, or your parent should read those instructions.
And so there's a whole process, even when it's in place, to go through. Not only training the staff, training and making sure that we're using it in terms of the right protocols.
Right.
Because you had a CT, so people are using CT to get MRI. You want an MRI, it doesn't quite work like that. So there are going to be certain protocols that are going to be have to set by the internal team, and they're already working on that.
Okay, I'll let you come back to talk a bit more about the MRI, because that is some more groundbreaking news happening in your directorate. You have all the action happening there.
I'm making it happen, sir.
We have that WhatsApp caller, that person who sent the WhatsApp, on the line. We'll take a quick commercial break. Of course, this program being brought to you compliments MedSafe Medical Supplies, and we'll come back with that caller who had that issue with our medical records department.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Back with you on the Pulse Radio Show. So the caller, she spoke to our producer Kimberly Skeet. She didn't want to go on, but hopefully she left that information, and we'll definitely investigate that problem that her family had with medical records.
I'm going to say this. It's going to sound a bit strange coming from a physician, but I'm just very proud of that particular Barbadian, for coming out and expressing, herself. I always say, as an institution, one of the things that we must be able to accept and understand is criticism. I've always said it during COVID. I kind of like criticism because it allows you to address things, look back, see how you can improve things. Take a self-reflection on what you're doing and see how you can improve it. But it also gives the opportunity for us to give information to people as to how we're going to move to get there and what strategies we've thought up to move together, like I talk about the electronic record system. So probably might not have until Miss Bob would be on the opportunity to talk.
She'll get an opportunity to come very soon.
And so, but I'm preempting her a little bit. I'm not going to talk too much about it since it's her area. She'll be able to tell the public more about that. But it gave me the opportunity for me to give you that inch of a snapshot of what's coming for every single Barbadian with the electronic medical record system.
Funny enough, when you look at these improvements and you look at all that is being done to make sure that people can connect with us, that is the reason for the Pulse radio show. It allows the average Barbadian to call us, voice their concerns. We have protocols for people to make their complaints. People use social media a lot now, but we always ask those, if you have a challenge with the Queen Elizabeth Hospital, there's a clinical risk department. You can come in or you can call the clinical risk department. I'll share the numbers shortly. And the numbers are on our website. You can just go to www.qehconnect.com and you'll go and you'll see how you can connect with us. Right to the bottom of the page, you can see exactly how you can share that complaint. You can either come in, you can do it online, or you can make a phone call. But the best way for us to respond to your concerns is by calling us. You may go on the radio show. You should come on this radio show, if anything, but just don't go and complain. If you want to complain and have your complaint addressed, the best way to do it is by coming directly to the source.
Yeah, and that's why I said just now I'm very proud of I don't know who you are. I'll probably even reach out to you after if they allow me to. But I'm proud that you actually called to say that, and I think we'll try to get it fixed for you.
Back to MRI and the opportunities on the horizon that will bring in terms of improving our services.
Yeah, so right now in QEH, obviously we have CT scans, 3 of them. That was a big feat. 3 alone, which is a lot. But I think one of the things that was missing was MRI, and I think the fact that we are now embarking and try to start the process for this and try to complete it, try our best to have it completed, certainly into at the end of the year. We're trying our best to do that. I think now that we're going to have that in place, it means the hospital no longer really have to be outsourcing these things. And if you may go to outpatients clinic and doctor says you have to go through a long sometimes process to try to get approval. Sometimes it's short, some is longer depending on complexity. Then I think now with that in place, you can be assured you'll get your MRI once it falls within the protocols that will be set by the specialists who deal certainly with MRI. It should be our radiologists. And I just wanted to stick a pin there and take the opportunity to reach out and to speak to the radiology department. I know that there are some challenges there, and to tell them that we are, and they know that we're going to try to move ahead to try to get things even better within that department. Just want to congratulate them for the solid work that they do for Barbados, because technically the radiology department, I don't think Barbadians technically know that the radiology department is the x-rays. You call them x-ray department for most of you, but it's more than x-rays. It's fluoroscopy, it's CTs, ultrasounds, etc. There are 3 doctors who work there. Technically they work for the entire 3 plus SHO, but they work for the entire country because they do polyclinic studies, they read polyclinic studies, they read inpatient studies, they read A&E studies when people come in acute emergency, they read studies for people upstairs. So it's a bit challenging for them, and teleradiography will help with that. That's why I'm really pushing. It's one of the things I'm really, really, really pushing to get sorted. But we've come up with a few ideas only this Friday, even to try to to get things going along. And for those cancer patients, for example, we might have imaging to be done, and the doctors rely on those reports to try to make appropriate decisions, timely decisions, so that that we can try to save as many people as we humanly possibly can. That type of imaging becomes crucially important. Getting information from that, so you see how the patient is improving and progressing. And I'll just stick a pin here to also say that I've really, really impressed with the sort of work that's been not my division totally, but I'm just going to stick a pin to say I'm really impressed with the sort of work that oncology has done over the last few months for every single Barbadian, and I think we'll be going towards better as time goes on. So that is a sort of activity in motion, and we will work along with them both from the pharmacy perspective and also from the radiology perspective to have an overall improvement in care within that particular area.
Yeah, and social services also doing some good work in getting those patients who are due for that oncological care overseas. Of course, we are still working on that linear accelerator installation. We should have some more news for you on that shortly. So stay tuned to the Pulse Radio Show, because all of these things we will keep you updated on. Another update coming for you, and I know I promised this at the start of the show, our hematology clinic. We did have some concerns recently that we have now been able to address, and I can tell you that tomorrow, those patients who are to come to the clinic tomorrow should be getting a call. We have the staffing on the ground and in place. We should see some improvement as far as treatment in the hematology clinic starting tomorrow. That is some great news for us and great news for the patients who use the service. We just want to make sure that you are covered. If you have any questions, you're a hematology patient and you have questions about your care, you can call 536-4800, 536-4800, and get some direction. I remember during that meeting on August 19th, we had about 65 patients and 36 relatives there. You were addressed by our CEO, Mr. Clark, and by our Acting Director of Medical Services, Dr. John Gill. They both assured the patients that the hospital was actively pursuing every option available to resume the clinic operations as soon as possible, and we are at that point. So Tuesday, that will be September 2nd, we should have some resumption of service within the hematology clinic at the Queen Elizabeth Hospital. I'm so happy to say that. We just want to see that service get going so we can meet the needs and demands of those patients there. So that is another piece of information that we wanted to share with you. And again, for those patients who have immediate questions, 536-4800. You call that number and we should be able to give you some answers as far as your hematological care is concerned. Dr. Forde, we wanted to give at least one caller an opportunity, to call in very quickly to if they had any questions or concerns. 4341007 and 4341070. WhatsApp 4341007. As we wrap up what you are doing, your team is doing in clinical and diagnostic services, what are those key messages that you want to leave with our listeners?
So I think the key messages from my standpoint is that we continue to work for the betterment of every single patient within the institution by the things that we've implemented, talking about introducing antimicrobial stewardship in a bigger platform, actually having people actually responsible for that, apart from myself, an infectious disease pharmacist, which is absolutely new for the country. And many countries in the Caribbean don't even have that in place. The improvement in nutrition services, in terms of interaction, looking at obesity and education in terms of dialysis, the improvements in the radiology service and the improvements to come in terms of the introduction of MRI within the institution, as well our lab services, just total change within our system and the ability to detect organisms much faster than sometimes 2 days, 3 days. We go down to 40 minutes once the sample is pure. And the introduction of new equipment and training within that area, the expansion or the potential expansion of the pharmacy system, even from home delivery, to expand clinical services on the ward, and that is coming very, very soon because we've gotten the staff position for that. Again, that's going to be totally new to the institution and totally new to the country, and having a clinical pharmacist post, which I didn't talk about before, but the rehabilitation services. We expect to have an expansion or coming together of the rehabilitation services, thanks to our friends and partners who are going to help in that particular build.
We have a call here on the line. Good morning, caller. Welcome to the Pulse Radio Show. How can we help?
Yes, good morning. I just want to ask a question. When I'm finished, I'm going to put down and listen.
No problem.
I have a situation a few weeks ago where we would have gone to the polyclinic to get blood tests done.
Okay.
I understand they come down to the hospital. Why is it that every time we blood test, we go back to the results, we cannot get anything at all?
Okay, so that's a difficult that's a difficult one for me to answer. John, I
And
can't.
I will tell you, don't put down because we may need your information so that
Yeah.
we can investigate it.
Yeah.
And we would ask you to leave that with Kimberly, our producer. So go ahead, Dr. Forde.
Yeah.
Okay.
So don't stay off the phone. Don't run from me. You don't run away. You're gonna make me frightened. Don't run away. I want to talk to you. All right. I love everybody. I love you too. I don't know you, but I love you. I'm just gonna get to the answer for you. Okay. So I'm not
All
sure
right.
what the situation is, but just to let you know how the system goes. So generally, if they take the QEH runs all of the polyclinic tests. I hope in the future that that might change, but who knows? But we run all polyclinic tests that are sent to the polyclinic, but some of them are also sent, depending on the test, to Best of Santos Clinic. So it comes through. I have a limited time here, so I'm going to speed a little bit. So it comes to us, we do the test, it goes into our system, so the polyclinic doctors are able to see it on the system. The question is, if it keeps not being found, is it sent to us at hospital, or is it even sent to Best of Santos, who runs specific tests that we don't run within the hospital, like for example syphilis, etc.
All right. Well, let me make it a little clearer.
Mhm.
It is for a dementia patient, right? We are trying to get the B12 folate that's down that line.
So no.
I was made to understand that it goes to the hospital.
Right.
Because after the second time we did it, and I called and asked a question at the best lab, and they told me that they don't do that.
Got you.
It goes to the hospital.
You see why I want you to stay
So
on the
the
call?
problem,
'Cause now
yeah, I
you're able
know,
to help.
right?
I get able to help, So right, so you're absolutely right. So you hit a nail on the head. So B12, things like B12, folate, and iron studies are sometimes run in batches. I think there was an
Yes,
issue
that's what I was
recently.
told.
Exactly. See, I don't always tell the truth. I always say that even if it's bad, you might not want to hear. Sometimes on occasions, they always run in batches. But I think the important point here is, in recent times, there were some challenges with reagent for these particular elements. So I think the reason with the B12 for sure, which I know there was a challenge with reagents for that. Which is not at us generally try to get them from overseas to run those samples. So I figured that's what happened in those particular cases. I don't have any more time on here, but so in view of that, what I'm going to ask you to do is please leave your number. I will reach out to you and I'll connect you to the lab and try to figure out what's going on. So those challenges happen sometimes when they run in batches, and then obviously when the reagent comes back, you then have to start running samples which were from before. So I figured that's what happened.
So please.
Again, sorry.
Yeah,
for that.
well, it's very, very, very frustrating because the guy did 2 tests and none of the 2 we didn't get the results. And right now I have a paper here to take anywhere I could get it.
Talk to me offline.
Right? Yes.
I
And not only that,
Okay.
because we're out of time, and so leave your number with Kimberly so we can investigate.
I'll
Okay.
contact you.
All right.
Thank you very, very much. We appreciate you calling. Just another note quickly on the hematology clinic. I just got some news. It will happen this week, but that clinic is now on Friday. So by then you'll get those calls. For those patients who attend the hematology clinic, we will have everything in place for you by Friday. Friday, we will have everything back up and running in our hematology clinic. So those of you who have been asking questions and sharing your concerns with us, we will be reaching out to you very shortly so that you can get back on track with your hematological care. That's it for another edition of the Pulse Radio Show. We covered a lot, Dr. Forde.
Yep, for sure.
Great having you here as always.
Yep.
You will see Dr. Forde again before the season wraps up, I'm very sure, when he comes to update you later on again about where we are with the MRI and some of these other changes that we are seeing happening under the 2025 to 2028 strategy. On behalf of Dr. Forde, I am Shane Seeley, and also you'll see very soon again right here on the Pulse Radio Show, Dr. Christine Greenidge back from her leave, and she will be with us to share more with you about all of the things that are happening at our Queen Elizabeth Hospital. Thank you for being with us. See you next week.
Bye.